today, and I want us to get through it. So, hello everybody. I'm Allison Agwu, and welcome to the JHA Wiki Virtual Toolkit series, run by our funded by our Y and Y Leads per D program. And the goal of this series is to engage and amplify. So, briefly about us, if I can, aha. So JHM Wiki, it is in some other language. Our vision essentially is to lift up care for patients who are living with HIV, particularly women, infant, children, and youth. We're about 5 distinguished programs across Baltimore. The Johns Hopkins program, which I am the lead of, the Women's HIV program, Sinai, University of Maryland, and our psychiatric services at Hopkins. And literally the goal is to develop and solidify a coordinated response to the things that are needed to optimize care for women, infant, children, and youth, aka WICI. Again, mission is to build upon the structures we have, not to duplicate, but to actually amplify and coordinate our successes and amplify our positivity as we aim to improve care across the region and across our systems. So the goal of this series, which is our signature series, is to engage and amplify experts. So who are experts? They are all of us. So that's not just us here, but all of you. If you see something, say something, we want to hear it so we can amplify how well we do for our populations and really want to lift up and acknowledge our funding from HRSA. So today, again in Chinese or whatever language that is, I'm not sure what that is our Ready, Set, Inject, a toolkit on long-acting HIV treatment, and really to focus on youth. And those are the objectives that we had there, very, textbook and objectives, but reality is I want us to really focus on what we need to know about long-acting, demystify, and make it approachable and understandable. And I'm really excited to have Megan Armbruster, my clinical nurse case manager and medical lead. She's a nurse, but also a fabulous young lady who has been really integral to the development of our long-acting program. So what are we doing today? So Ready, Set, Inject. Today we're going to learn about our HIV treatment options, including LAI or long-acting injectables in a way that young people in particular can understand. And I think if we make it for young people to understand, then everybody can understand. So if you're a little older and more seasoned, this is for you as well. But again, it is for us all to be on the same page. We want you to know and show what to expect before, during, and after LAI or long acting. And then we want to hear from youth and are so excited and honored to have some youth with real world experience with LAI who were willing and able to come up and tell us about their experiences. The goal is to address concerns, to address myths, to reduce stigma, and to support informed patient-centered decision making. Disclaimer. This is not meant to be exhaustive or to take the place of talking with your provider. This is to provide a framework that then allows you to then have further conversation and as a provider be able to know how to reach people literally where they are. So briefly, so these are the goals of HIV treatment. I think it's important to start here. If you all the way at the left of this graphic is knowing your diagnosis, so making sure you're tested, finding a provider, starting HIV treatment, and then really going on the journey of taking medicines every day. And I'll put an asterisk near that because we'll talk a little bit about that. Seeing your healthcare provider regularly, but then also your physical mental health with the goal of being undetectable, but also the other things that you need to do to also be healthy. This is that slide that says, the goal here is getting on treatment and staying on treatment. And we get to the point where we are undetectable in our viral load, we get to U equals U. And the goal really is that lowest level of viremia, where your viral load is less than 120. One, optimal health for yourself in terms of maintaining that undetectable viral load, decreased likelihood of having advanced HIV and a weakened immune system, and that U equals U, undetectable equals untransmittable. I think important to highlight most of what we talk about here has to do with pills. Okay? Let's talk about rationale, because I think it's important to really think about it this way, because the goal is really not just for you to talk about injectables, just in treatment in general. So it's important to understand why do we even treat, just briefly. So on the right of this graph is the HIV life cycle. And on that life cycle, you'll see all the different areas that HIV essentially, and the things that HIV uses to, one, get into the cell or the CD4 cell, gets to then making baby cells, and all these little steps, reverse transcriptase, replication, assembly, are parts of what the virus uses to then create the machinery to then continue to make additional viruses and to decrease the immune system. I like to compare it to each of those different areas as part of an alarm system in your house, right? So if a burglar is trying to get in, if we think about HIV as the burglar, they can get through a window, they can go through your motion detector, they come through the back door, and antiretroviral treatment is meant to literally block different ways. If you think about it as a security system, not one, but two different ways that you're protecting your house. All right. So your body is the house, and your treatment is essentially made to block different ways of getting into that house and for that burglar to get into your body. That's how I explain it to my young people when I talk to them, and I hope that resonates with you. So in terms of medication, we want at least two ways to block that getting into the house. Example, we have Biktarvy, which many of you have heard about, bictegravir and tenofovir. It blocks that entry in a couple of ways. One, reverse transcriptase, number three, and then number four, integrase. So it's two different ways to block entry into the house, the DA house. Back in the 90s and for a long period of time was multiple pills to do those things, right? So we had handfuls of pills taken multiple times a day. Now, most of our regimens are one pill once a day. And the goal has been to simplify, so fewer side effects, less drug interactions, and less pills. And really, we have many options for highly effective medications that's taken orally. And it's important to know each of the different medications have and timing once a day, or how you're supposed to take it with food or not food, and knowing those things are important. And some may have different side effects, whether it be stomach upset or nausea or no side effects. And it's important to talk to your provider about that as you design a regimen that works well for you. I highlighted that pills are what we've oftentimes counted on to get to that undetectable, but taking pills every day can be hard. And this is actually a study among adolescents who were challenged with taking their medications. And what you can see are all the different reasons that people said that they were challenged in taking their medicines. And you can realize that one person can have multiple different reasons why. One day it may be they ran out. Another day it may be that they forgot. Another day may be about they were traveling and going someplace, or there were people over at their house and they couldn't make it, take their medicine because they were worried about disclosure. So multitudes of reasons in a given day. So this gets us to the long-acting injectables, aka the shot. And I'm going to talk about two main ones that we think about, but there are others that other ways of giving. So essentially, remember what we said about the life cycle and getting into the house. One of the more common ones that we hear about, the first approved full regimen is cabotegravir and rilpivirine, and that's injectable antiretroviral therapy approved for adolescents 12 and over, 35 kilos or more, who are already suppressed, so that on treatment and their viral load is suppressed. I caveat that to say that there also has been an increased move, and in the guidelines now also talk about for adolescents and for people in general who are having challenges with adherence, that long-acting could be an option for them. And that's in the guidelines, though it's not FDA approved for that indication. So 2 to 3 shots per day, per dose, given every 1 to 2 months. So 2 shots in the glutes, and Megan's going to tell you a lot more about that every 1 to 2 months. There are some reasons why you wouldn't be able to get long-acting injectable, and that includes if you have hepatitis B infection or you have allergy to one of the medicines that are in it. The viral control is similar to antiretroviral therapy. The one they've done and looked at studies, the quality of life, people have really rated the injectables more superior. There are risk factors for failure. Of course, you're not coming back for your medication, obesity or mutations to the drug, or specific strains of the virus where this medicine could not be used. The main side effect for that one is injection site pain, and again, talking through that. Then again, the main drug is Cabenuva. And then there's lenacapavir, which is another medication, injectable, given every 6 months subcutaneously. Now that side effect is nodules, only approved for those who are 18 and older and 35 kilos. If you were on last month where Dr. Fields talked about injectables for PrEP, he talked about this in a way and said, this is how we kind of hear about things, very technical. And I think it's important to show you the technical, but then also let's talk about what you really want to know when you're thinking about oral versus injectable. So this is kind of what you want to know. They're daily pills on the left side. It's taking one pill once a day, effective when taken regularly. But we talked about the challenges it can be. Following up with your doctor every 3 to 6 months. Sometimes people follow up even less than that. Why some youth may choose pills? Familiarity, it's routine, daily control, not having things in your body for a long period of time, no injections. But there are things that can be challenging. Remembering to take a pill every day, the privacy at your home or your dorm where you're worried about somebody seeing your pills if your diagnosis is not uh, known. And then building a routine, remembering, well, a lot of times our lives are hectic and chaotic. Your work schedule is different. You're in different places, you're traveling. And so remembering that every day can be challenging and having a routine. Long-acting injectable, at this point, all the shots are given in clinic. Again, we talked about every 2 months for cabotegravir pivirine, and then every 6 months for lenacapavir for people, again, who have resistant HIV. Highly effective, as with the pills. Why some youth choose shots? They don't have to remember a daily medication. So some of that adherence challenges, whatever, can be minimized. It's more private. There's nothing that you have to do at home or to hide. You come take your shot and you leave. You kind of set your reminder to do it and you forget. What can be challenging? The injection discomfort, and we'll hear from our fabulous youth experts about what that looks like and feels like. There can be a lump or a bump at the injection site, particularly with the subcutaneous one. And then having those regular clinic visits, you can go from having a visit twice a year, which you may have with the oral medicines, to now having to come every 2 months or every 2 months to get the shot. And then you have your doctor's appointments. And so there may be some increase in how you have to engage. And then regular clinic visits to get the shot is required because, again, they're not given at home at this point. You have to come in to get them. And you must stay on schedule to do that. And then it's not easily stopped once given. So you get the shot, it's in your system for 2 months. And then if you decide you need to stop, you'd have to transition to something oral to then keep medicine levels high in your body so there's not development of resistance. So it's not as if with your medicines you stop taking them because you want to and you talk to your doctor about it. It's in your system for 2 months, even if you decide you want to stop. So there's some differences and nuances with that. Key differences, there are many oral options right now, right? So I showed you that whole big graphic with 30 different combinations of pills or several that you can use. You also have to already be suppressed to start injectables, while orals you start when you're not suppressed. The side effect profile is different, particularly with the injections or shots. And then how long the drugs stay in your system is different for the injectables and shots, so thinking about that. And then the side effect profile may be different. And there's cost and logistics concerns or differences between the two that is important to understand as you think about how to weigh those different options. I love this graphic from when Dr. Fields presented last month. So I stole it from him. So there are different rhythms of treatment. There's the pills daily with the visits every 3 months. There's carbopivirine where there's no daily pill, visits every 2 months. There's Len again for those who require where it may be every 6 months for the shot. But the reality is, for a given person, where your rhythm is may be different on the time of year by the partner you have, the place where you be. And so there are different rhythms for over time, but also within an individual. It's important to think about where you may be at different times today, tomorrow, the next year, as we think about how long actings may fit into your life or just treatment in general may fit into your life. I'm going to turn it over to Megan to talk about transitioning to long-acting treatment and some of the logistics.
Okay, so this slide kind of reviews what our process is for giving the long-acting injectables here at Hopkins. So it all starts with a patient and provider discussion. Our patients meet with their care team and review the different treatment options available to them. Some patients will decide that they want to stick with their oral medications because that's been working really well for them, or maybe they have a needle phobia or they're not quite ready to make that transition over to injectables. And then other patients might hear about it and think that that sounds like a really great option for them. They don't want to continue to take a medication every day for the reasons that were listed on the other slides. And so we have that discussion. We talk about what it looks like to make the switch to long-acting injectables. And then we also talk, one of the things that we stress is the importance of making it in and making sure that the patient's able to come in every 2 months, making sure that that's something that they have some flexibility in their schedule to be able to fit those visits in, because that can be challenging for some of our patients who might be away at school or have a job where it's harder to leave during the day. That's a reality that we definitely include in the discussion, is making sure that patients are able to come in every 2 months for their injectable or every 6 months if they are on lenacapavir. So the next thing we do after that discussion, if a patient says that they are interested in making the switch to long-acting injectables, we check to see their resistance, to see if they have any resistance to the medications that are in the long-acting injectables. Um, if there is resistance to one, then maybe they're eligible for the other, which is good. And as more and more long-acting injectables are coming out and are being researched, we have more options to provide for people who do have resistance, which is great. The other thing that we check is the viral load and CD4 count. So historically, since we started giving injections, it has been a requirement that patients are undetectable. It would be great, and as we move forward, we've had some success with letting people start long-acting injectables if they do have an elevated viral load. But historically, that has been one of the requirements to start, is that you have to have an undetectable viral load. After that, this is kind of some behind the scenes stuff, but the nurse myself will create a therapy plan. So the therapy plan has the injection orders in it, and then it also has medications and safety precautions that we can give in case a patient were to experience a reaction when getting the medication. The provider signs that therapy plan, and once their signature goes through, it's sent to our financial clearance team. And the financial clearance team helps to get the patient the injectable through their insurance. So they work with the insurance companies to make sure that the medication is approved. Medications are usually approved for a year. This is kind of the slowest part of the process, is going back and forth with the insurance companies. I've noticed that things are starting to get a little easier, and we're getting more and more approvals, but this is kind of the slowest part of the process. So we like to make sure that when we have the conversation with the patients about the switch, that we set a reality of what the timeline might look like. Some plans might approve a switch to a medication as quick as 1 week. Others can take up to 2 months because we have to go back and forth with the insurance company um, to appeal decisions that they might have made. So once it's finally approved, then the patient, we're able to schedule them. So here at the Harriet Lane Clinic, which is a pediatric clinic, we see patients until the age of 26. We give the medication down in our infusion clinic, which is hospital space. And so we schedule the patients for a visit there. And then we give the first injection. For Cabenuva, the injection that we give here, patients get their initial injection, and then they have to come back in 1 month. And then there are monthly options for Cabenuva, or most patients opt to get the medication every 8 weeks. So yeah, we do that first injection, and then patients come back. That first injection, patients do share, is the most challenging, but we've heard from patients who have been on it for a long time that it does start to get easier with each injection. So I'm curious to hear if that's been the experience of our patients who we have with us today. So long-acting injectables, they are medications that are slowly released into the bloodstream. So there's two different sites that the medications, or there's two different spaces within the body that the medications go. So lenacapavir, for example, is a subcutaneous injection. So that's given into the yellow fatty part of the tissue. So it goes right underneath the skin into the fat. It's injected there, and then it releases into the bloodstream over the next 6 months. And then once it's run out, it's time for you to get your next injection, and the same thing happens. It's given into that subcutaneous space, and then it filters through the bloodstream for the next 6 months. Cabotegravir is given deeper. So that is actually given into your muscle. We have some fabulous videos that demonstrate where we do these. But typically we do cabotegravir. The muscles we use are the hip muscles, which are the ventrogluteal muscles, or the dorsogluteal muscles, which is back on the butt. So with that, we can go to our fabulous videos with Lady Diane. Oh, I can't hear it, Dr. A.
We are joined today by our patient Ms., who has kindly consented to be part of this video. So first things first is we are going to make sure that we have all of the correct supplies before starting. So we'll have clean gloves, we'll have an alcohol swab, a Band-Aid, and a gauze pad. And then of course we'll have our medication. Before we do anything with our patient, we always want to make sure that we have nice, clean hands. So we're going to go ahead and do hand hygiene. And we're going to put on our nice, fabulous, clean gloves. In order to do the injection, you want to make sure that you are in the correct muscle. So for the intramuscular injections, it's administered in the ventrogluteal muscle, which is to the side of your glute. So in order to find the correct spot, we'll have our patient turn towards us so that we can find the correct anatomical landmarks. So while Ms. is turned on this side, what we'll do is go ahead and uncover. And is it okay if I touch? Okay. I'll pull this down just a little bit to expose part of the gluteus muscle. So while we have Ms. positioned like so, what we're going to do is we're going to take our non-dominant hand at the top of the femoral bone like so, and then your right hand is going to go at the tip of the hip bone like so. Your thumb is going to be pointed and facing towards you, and you're going to separate your forefinger and your middle finger like so. And this spot is going to be your ventrogluteal muscle. I'm pressing down with my thumb to make sure that the spot is firm, to make sure that we are in the correct muscle. So that looks good. Once we've found our spot, what we'll do is take our syringe with the cap on and go ahead and mark our injection site like so. And once the site is marked, I'm going to go ahead and release. What you're going to do is go ahead and take your alcohol swab and clean the site. So nice circular motions. And let that dry. While that's drying, we're going to go ahead and prepare our Band-Aid and our gauze, and we're going to let our patient know to take a big deep breath to get themselves ready for the injection. Perfect. Are you ready? Fabulous. You'll feel me touching a little bit. And what you'll do actually is take your non-dominant hand, uncap your needle, and what you'll do is pull down on the muscle like so in what we call a Z-track method. So this allows you to pull down the top layers of the skin and subcutaneous tissue to really expose that muscle. So pull down, find the spot that we just marked, and then go all the way in. Once you're in, what you'll do is just push the plunger down slowly to administer the injection. And you're going to pull straight out. Release the muscle like so. Put your safety onto your syringe. Apply your gauze and apply a little bit of pressure just in case there's some bleeding. Are you doing okay? Perfect, you did fabulous. While applying pressure, I'm going to go ahead and take my Band-Aid and apply it onto the injection site. Thank you so much. Go ahead and pull this up for you. Perfect. And that's how you do an intramuscular injection. Hi, everybody. Welcome. Hi, everybody. Today we are going to be doing a video demonstration on the subcutaneous long-acting injectable. Today we are joined by Timmy Tum Tum, who has kindly consented to join us in this video demonstration. So first things first, before we go ahead and start the procedure with our patient, what we're going to do is make sure that we have nice clean hands. So we'll perform hand hygiene and put on our fabulous clean gloves. We are also going to make sure that we have all of our supplies ready for the injection, which is going to be our clean gauze, alcohol swab, and Band-Aid for afterwards. We are also going to make sure that we have our 2 medications because the subcutaneous option is 2 injections that's given every 6 months. There's actually 2 parts to the subcutaneous option, which is the oral part. So that means that you'll take 2 pills on the day that you get your 2 injections, and then the next day you take 2 more pills, and that completes the entire dose. So for today, we are going to show you how to do the injection. Timmy, is it okay if I go ahead and pull the blanket down? Perfect. We'll pull our blanket down to expose our injection site, which is going to be in the abdomen. So subcutaneous means that the injection is given right underneath the skin, which means that our needle is going to be a little bit shorter than the intramuscular injection. So for the sites, we are going to identify first our belly button, which is right here, and we're going to go about an inch or so away, which is right about here. You want to make sure that your injection sites are given about 4 inches apart. So if our first site is here, we'll go right about here for the second one. So once we've identified our first site, what we'll do is go ahead and take an alcohol swab. Go ahead and clean that injection site and let it dry. Again, it's very important that you let the site dry after you clean it with an alcohol swab, because if you poke yourself with a sharp needle while the alcohol is still wet, it's not going to feel good. And while that's drying, we're going to go ahead and prepare our gauze and Band-Aid. Looks like our site is dry, so we're going to go ahead and administer the injection. Do you feel like you're ready? Perfect. We'll take our cap off, like so. And what we're going to do is we're going to pinch an inch of the subcutaneous tissue, like so, and we're going to administer the injection at a 90-degree angle, so straight down. So pinch your inch all the way in, administer the injection. Perfect. Then pull straight out. Get your safety on, and then apply your gauze if there's any bleeding. And then apply the Band-Aid onto the injection site. For the second injection site, we are going to do the same. Do you feel okay? Cool. Do you need a heat pack or a cold pack? Okay, maybe later. So we're going to find our injection site, again, 4 inches away from the first one. So we'll go ahead and clean that. Phenomenal. And while that is drying, we are going to go ahead and prepare our Band-Aid. Pause. Apologize for all the trash I've piled yonder. All right, do you feel like you're ready? Perfect. Again, we're going to go ahead and pinch an inch all the way in and administer your injection. All the way out. Safety on your needle, gauze, and then a Band-Aid. Perfect. Hi, everybody.
Okay, so I'm going to turn over to you, Megan, because I think all that is good and well, but we wanted to get through because I think the youth experiences matter the most. I'm going to turn over to you to introduce our youth and then go from there.
Okay, sounds good. All right, so we are joined today by 2 of our fabulous patients. Avion is with us. Avion is a 26-year-old skateboarder from Edgewood, Maryland, who was diagnosed with HIV in childhood. He transitioned from oral tablets to long-acting injectable HIV treatment in August of 2025. And so he's going to read a statement today for us that he prepared. And then we have a question and answer session that we're going to do with Fashionista. So Fashionista is a 24-year-old music lover from Baltimore who was diagnosed with HIV in 2024, and they transitioned from oral tablets to long-acting injectable therapy in May of 2025. I had the wrong month in there. So we will start with Avion. Avion, if you're ready, I will unmute you and you can share. We're so excited to have you.
Am I unmuted? Not sure if this is working.
You are.
Okay, we're good. Oh, hi, I'm Avion. That also means water, just so everybody knows. Yeah, the fancy water company, but spelt with an A. Just wanted to say that. I wasn't always just on pills. I guess you could say I went through the whole 9 yards when I started out on treatment. It went from having a feeding tube to, liquid medicine. There was this one product, forgot what it was entirely. It was like this medicine milk. That didn't go too well. I had horrible eating habits, and it carried on. Then we went on to just medicine, liquid medicine by mouth. Wasn't having it. Then they swapped me over to pills. At first, it was at 3 pills. Then it went down to 2. Then it went down to 1. The whole 9 yards. Then you forget to take a pill every morning. It's normal, but I only take pills whenever I usually just take ibuprofen or something. So over time, it really bothered me. And sometimes the doctors I used to have, they think I was purposely skipping, and that would create some friction with me and my parents. But I wasn't doing it on purpose. There was just side effects, you know. I wish there was just something better. I was a kid and I didn't know any better. So what else was I supposed to do? So kept taking my medicine. One day, doctor's appointment. Random woman came by. She had me sign something for some sort of survey for taking a shot for HIV. That's where Cabenuva comes in years and years later. Ever since then, she came back. I was a part of the whole thing because, better quality of life. I wanted to keep my viral load down. It was very important. I don't want to know what happens when your immune system gets compromised. There's a lot of stuff I want to do. I skate a lot, game a lot, work full time. I drive every piece of forklift equipment. Life's pretty cool in Ferrolo. So switching over to Cabenuva, I no longer need to take no freaking pills anymore. I'm glad that I just, have to make my appointment, normal doctor's appointment, and just get the shot. That's it. Life's been pretty good lately, so I'll tell you that part. Mine is the hot temperature, but hey, that's Maryland for you. Yeah. So,
Thank you so much for sharing, Ian.
yep.
We are so happy that you're here with us today.
Yep.
So I have Fashionista here as well. So Fashionista, can you share with us your favorite artist and tell us a little bit about yourself?
Hi, can y'all hear me?
Yes.
Okay, I am fashionista. My favorite artist is, of course, Mariah Carey, the Queen. And I've been diagnosed since July 22nd of 2024. So it's ready to be 2 years next week. And living with it was kind of so
Oh,
because I
my
was
bad.
the first like year and a half, I was taking Biktarvy, and then I had switched to Cabenuva. So throughout it, it was like two different versions of myself.
That's a very interesting way to put it. Do you mind like expanding on that?
Yeah. So, of course, if anybody get diagnosed with HIV, you're going to be sad and depressed, which was my main thing that I didn't want to do because prior to that, I have never had like any diseases or anything, but I was working on my confidence. So then once I was diagnosed, it was just like I'm in my head to where though I've seen the gays and the girls, aka trans women, lose their self after becoming diagnosed. I've seen it on shows and I also seen it in real life. And that was the main thing that I just did not want to happen for myself. I truly care about myself. So when I was diagnosed, I truly wasn't even I wouldn't say I wasn't worried about, I was just worried about my mental. Like that was my main thing. So yeah.
Okay, thank you. So can you share a little bit about the conversation between your provider and your care team, if you remember what that was like?
The day I was diagnosed and I had came in here to get when I had came in here to get like start my treatment and basically figure all about because prior to that I was not educated on HIV. I knew little things but I didn't know depth into it because to be fair I was scared to even find out just what I think every young person is scared to learn more about something that is mainly in our community, well, the gay, because I am a gay man in the gay community. But when I came here and when I was diagnosed and then we was talking about it, they was showing me the pills prior in the past that people used to take, and then they was showing me the Biktarvy pill. They did mention Cabenuva, but honestly, it wasn't on my mind because I'm just worried about what's going to happen right now. I'm not worried about no shot or anything like that. So they told me about Biktarvy. I started taking Biktarvy, and as time went on, I started. It was I started to not like Biktarvy as much, and I did honestly forget about Capanuva until, as Avion said earlier, I was in an appointment one day and the lady had came and she had mentioned it. And then once she mentioned that, I was like, well, I might as well give it a shot. And that's just how it went from there.
Okay, so what motivated you to make the switch when she presented it to you? And did you have any concerns about switching from the pills to an injectable?
Okay, so what motivated me was I had seen a care maneuver, mind you. Well, my bad, I'm sorry, but prior to me getting diagnosed, I really would not see no type of commercials advertising any type of medication for HIV. And then once I got diagnosed, that was kind of all I seen, mainly
Mhm.
Biktarvy. And I'm just listening to the side effects, and I'm like, this is not it. Like this ain't it. And then the way it made me feel, nausea every morning, it just felt like a bit. And as I said prior, my main thing was my mental health. Like I did not want to have to wake up every day, reminding myself of the self-guilt that I done got this disease that I can't get rid of. And I wanted to go on and live my life and be with my friends because I am still young. And when I was diagnosed, I was 22. So I wanted to still go on and live my life. So once I had seen multiple Biktarvy commercials, but once I seen a Capanuva and I just compared the side effects and it was like, maybe a shot every 2 months is not that bad. So when I had came to an appointment, I had brung it up and then I had did this survey thing and then I had did like probably like a 30, 45 minute interview with a man and he was basically describing to me Victoria, the pros and the cons and all of that. And then that's how I got into it. And to be honest, it was the best thing for me mentally because I'm not waking up waiting for that reminder to go off to remind me, oh, you got to take this pill. And then it also depends on your lifestyle. Like with me, I work a lot, so it was a bit for me to carry the pills with me, and then I'm trying to stop my job to hurry up and take this pill real quick and then get back to it. And then another thing with me is I was never really able to take pills. Prior to that, if I was to get sick, I would take a liquid medication. I would never take a pill. So taking Biktarvy was my first time taking pills, which is something I struggled with throughout the whole time. So that was another reason why I switched as well.
Okay, thank you.
Welcome.
Can you share more about the actual experience of receiving the shot? Have you experienced any side effects from it? How painful is it? And then how long does that pain last? And you can be honest with us.
Okay. Now, I'm not sure. I will say I guess it depends on your lifestyle and it depends on I would really just say it depends on your lifestyle. When I first received the shot, I would say I was like any child that's about to get a needle, especially in their buttocks. I've never got a needle down there before. So I was extremely nervous. I was nervous. I will say when I first got it, it did hurt, only because I never had it before.
Mhm.
And as time went on, it did start to hurt less. With me and my left leg, when I get that shot,
Mhm.
I basically they're gonna go paralyzed. And my left leg, like I walk a lot at my job. It requires me to walk 10,000 steps a day. So that was one of the cons with me because when I was talking to the man about it and he was saying, you get these shots in your leg, all I could think of, well, when I get a shot in my arm, sometimes my arm go numb and I can barely move it. So if that was to happen with my legs, how am I going to be able to do my job? So that was something I had to juggle back and forth with myself. Where do I want to prioritize walking or my mental health? That's just what it was for me. Um, the leg pain for me was crazy. It was excruciating,
Mhm.
and I would say it really lasted a week. My right leg did not feel no pain. And I would even get the medication switched because one of the medication is thicker than the
Mhm.
other. So I was thinking maybe it's the thicker one that's in this leg that's causing it like that. And I got it switched. And no, it's just my leg. I'm not 100% sure, but it do causes me pain. But for me, it only lasts a week. If like right now, and I would recommend stretching your legs stretching period because it helps a lot. At first, when I first started getting it, I was not stretching. I would just get it and then go to do whatever I'm going to do. I will go home and lay down and then get back up, go to work, do the same thing over dealing with this pain. So now I stretch and it actually helps me out so much compared to just 4 months ago.
Okay, that's helpful to know. Do you do anything else? Like do you ice it or heat it or
I
take a
do
bath or
use
anything?
a heating pad on, not on my right leg because the right leg only hurts for that day, but my left leg because it hurts so much, I do use a heating pad, and the heating pad do help a lot. It do.
Okay. Um, how you mentioned that it's helped to improve your mental health and
Yeah.
everything. Would you say that's been kind of the main thing that it's changed with your day-to-day life, or is there
It
anything else you can think
is
of?
when I say I honestly be forgetting I even have HIV.
Mhm.
Just because now when you get the pill within them 7 days, you're going to definitely, I mean, not the pill, the shot, you're going to definitely remember just because that pain. Like
Mhm.
after that though, once that pain go away and you living your life daily and you just doing what you do on a daily, you will only remember when the 2 months is up and it's time to go again. Or
Mhm.
maybe they'll text you like a month and some change and to remind you which day do you want to make your appointment on. They the only reminders you will have. For me personally, it was the best decision I made to get on Capanuva. I live I won't I do work a lot, but like when I go out with my friends and stuff like that, it is good to not have to worry about, oh, I gotta take this pill in a minute, or oh, I forgot to take my pill today, and then you getting scared thinking that your rival load rate. Because I'm a very paranoid person, so when I would like miss a day of the pill, I'm thinking my rival load is back at what it was prior to when I got it, which is not the case, but it's different for different people. So the Capanuva mentally was the best thing I could have did. It was the best.
That's interesting too. I like how you said that it gives you some peace of mind with your viral load
Yeah.
because when you would miss a pill, then it was just like another thing to think about. Is my viral
Mhm.
load elevated? Even if it likely probably wasn't, but it's like taking one of those things off your plate.
Yeah.
Have you shared with any of your family and friends that you're taking a long-acting injectable? And if so, what were their thoughts on it?
So my family and friends are educated on it through me because
Okay.
I have it. They're not as educated. So
Mm.
they basically said do what you think is best. Like if I think the needle was best, then do the needle. If I think the pill was best, then do the pill. So they don't really know much about it, but I will say they seen the difference with me taking the medicine and the pill. And one thing I wanted to mention earlier was the pill did have like a depressing state with it as well. Like I would watch and listen to certain songs and stuff, and it would just genuinely break my heart because you would think of the life. It's like you're grieving a little bit because you would think of the life you would have had prior to getting this, and then some people, of course, is born with it and stuff like that. But for me, I wasn't.
Mhm.
And for me, it was just like I was grieving a life I could have had,
Mhm.
basically.
Okay. Um, what information or advice would you give to another person who's considering making the switch from oral medications to a long-acting injectable?
I would tell them the difference between the medicine, that one is thicker and one is not, because
Mm,
you could get the needle and then they don't put the thicker one in first, and you probably think it's a walk in the park, and then you get that thicker one and you genuinely feel it going inside. I
mhm,
will also tell them about now it probably differs from people, but I will also at least warn them about the leg pain, especially if you walk a lot, because you're gonna feel at each step. You're gonna be very visibly limping, and it's you just want to at least know these things before straight getting.
That also reminds me to ask you, I like to hear from patients. Do you have advice to me and to other people on the call today who give the medication, advice for how to make it a more comfortable experience or like different techniques that you find
Um,
have been more helpful than others?
I don't know how you did it last time,
Hmm.
but that time was perfect because my legs actually did not hurt for that
Oh,
week. It
really?
actually hurted for like 3 days
Hmm.
max. And I don't even really remember that. Cause now I'm at the point where with my appointments, it's just like I come in,
Hmm.
hey, okay, we ready to get the shots, we do the shots, and then I go. But I really wouldn't change nothing now. Y'all, you take your step, you do like a three-step measures before you even insert the needle. So it's not like you just pulling your pants down and they're just inserting the needle. No, first
Yeah.
they check and feel that are your period before they even inject or before they even place the marker of where it's going to be at, they automatically feel right there. Then they place the marker, then they feel again to confirm what they're doing. Then they offer like a spray if need be, or if you just want to just get it over with, you just get it over with. But no, y'all take the right measures or steps to ensure that everything is going to be correct.
Thank you so much for sharing.
You're welcome.
Dr. A, do you have any additional questions? Or Avian, was there anything that you heard that you wanted to chime in about?
Yeah, let me think for a moment. Was it?
I put this in the chat too. So we will often, we have a child life specialist here who's fantastic and amazing, Jenna Dunbar. So she will often come down and assist. And then Jamie Margolis, who's our therapist and mental health coordinator, will also come down. She knows our patients pretty well and really well. So anyone who is feeling uncomfortable, especially if it's their first injections, that can be helpful. And then we use things, a lot of this I learned from Diane, is like a lidocaine cream that can be applied and then sits on the area for a half hour, and freezy spray we have, which is also helpful. So we have some comfort measures, but yeah, it's always good to learn about more too.
Again, did you have anything to add? I could see you nodding and weighing in mentally, but wondered if there's anything to add to what Fashionista had to say. Your experience are different, or
Yeah, pretty much. Just agreeing on most of the points, especially with like whether or not a person is comfortable to transition from different meds to another, especially whether or not they want to deal with more side effects and whatnot. Whether I mean, rather it being also different from person to person, but all that basically doesn't matter. I'll give an example. So I am on blood pressure medication, and that's a pill that I still take every day. So I already have that on a midnight alarm clock. Uh, that sucks a lot of water out of me, and it was a lot worse with the other HIV pills that I was on. Not just me having to worry about just other side effects because I work 40 hours a week. I have pulled a 60-hour week shift before, so that requires a lot of water, and having to be on that really did bother me a lot. So yeah, it was a really good idea to just make the switch because if you see more pros than cons, or if one outweighs with more cons than pros, which one are you really going to go for? That's what I would usually tell people if they really want to make that decision. um Another thing I want to add is my dad, who was with me at one point before I moved, when he was asking me, "Are you sure you want to do this? Get a needle in it?" He's been through all of it, so I mean, but he understands. He was around when LabCorp was, in business and whatnot. Not, but I guess I can understand him being paranoid. I told him, no, I want to make the decision, and this is a choice I'm going to make. And it's done everything from the past, done too much. And if it works well for me, my other brother, Jesse, he also has HIV. So if it works out for me and I'm still standing, might as well get him transitioned. So he doesn't have to wake up every morning. He doesn't go to school anymore. So I know it annoys him that he takes pills. So if I had to go tell other people who are in the same boat, I'd do the same thing. But again, other people's decisions. That's just me.
thank you for sharing that. I mean, I think what I'm hearing, it's about having options and choice, and it may not be what is for everybody. I'm curious if you could talk a little bit about both of you, there are commercials and lots of things happening out there and advertisements, etc. But what do you think the community or young people need to know about one, injectables or oral, but just about what's needed to support adherence and health with HIV? What do you think is needed, both of you?
Now, they're now in a state of medication that you will not perish from HIV. The way that this medicine is now, it's just not even possible. With Biktarvy and Cabenuva, either or, you're gonna live a long, healthy life. With Cabenuva, you will live what am I trying to say? A peace-free, more. You would not have to worry. Yeah, and I did want to touch on this earlier too when y'all said about the more doctor visits when you do Cabenuva to Biktarvy. When you come to get your Cabenuva shot, you're genuinely in here for like 10 minutes. It's never the only part, if anything, is when you gotta get checked in. Other than that, when you get the shot, it's really quick, really fast. You're really in and out. So it
Get in,
don't
get out.
I would say you genuinely just need to take like whenever they book your appointment, it's a 30-minute process altogether. Like an hour if you want to include transportation to get from wherever you are to the doctor's office, but altogether it's a quick 30-minute process, and then after that 30 minutes, you just go on about your day. Um, yeah.
I think the I think it's important to highlight, Megan and her team for just really trying to work really hard to make it seamless because, we recognize that it's more appointments, but as people think about what this looks like in reality, it's trying to make it so it's not disruptive. So it is something you can pop in and do and have it be as efficient as possible. Um,
Like my
Go
bad.
ahead.
But like I incorporated mine with my work schedule. So every appointment is right after I get off of work. Because I work in the hospital, I can just come over here, but I incorporate mine into my schedule. So right after work, I come right over here, and it's not like it's really messing up anything. And then it's every 2 months, one day out of the 2 months. So you have enough time to plan in advance that you have to do this. It's not like you gotta come down here, sit down here for 2 to 3 hours and do all of this. It's really fast, and it could be less than 30 minutes, honestly. But it is, of course, other patients in the hospital, so you do have to have the courtesy of that. But it's a really quick process.
I want to make sure we give time for people to ask questions in the chat. I do have one additional one that I'd love to hear your thoughts. But please, people, raise your hand if you have others. But would either of you be interested if they moved Cabenuva from something or the injectables? Because we're talking about Cabenuva, but there may be others. If there is an opportunity for you to give yourself the shot at home, would that be something that would resonate or be interesting to either of you at all?
Not for me now. Cause I really don't do needles. Yeah, it don't hurt now when I get it, but to give it to myself, that's like you trying to break your own bone. You just wouldn't
Mhm.
be able to do it. For me though,
Yeah.
but
Evian?
I will go ahead and say for me, it would have to be like me, I would say like later down the road, like maybe if I'm sitting somewhere in my 30s, if I'm still on the shot, because I'm not saying I don't really trust myself. I'm not a doctor. My mom wasn't a doctor, but she was basically a nurse. When I did see her taking care of herself and stuff like that, that's because she knew what she was doing and she had the proper procedure and knew what she was doing. So if I was to do something like that, meaning I wouldn't have to go nowhere, and I have in this day and age, you get everything DoorDash to your house. So if I just had that just sent to my house, and I would just be able to take my own accordingly on schedule, I probably would have to be on video call with one of the nurses or whatever just to walk me through. I'd be cool with that. I, you know what to do. Just be somewhere down the road, really.
Yeah, awesome. Megan, I'm looking at the time and want to make sure I look to make sure nobody has any questions. Want to make sure I give turn back to you, Megan, if you had any questions, other questions you wanted to ask.
I don't think I do. I just wanted to thank everyone for being here and really thank Avion and Fashionista for being here and for being so open and sharing with us today and taking the time out. You both were
Absolutely.
fantastic.
I wanted to share some closing slides. And then Megan, you can monitor the chat while we do that. Make sure I can get it over there. because I think there's some other people we want to thank as well. Can you see my slides in the right format?
Okay, there it goes.
Okay. So echoing Megan's thanks to all of our youth for sharing your experiences so candidly, the good, the bad, everything. And certainly it's helpful for, I know, for me to hear you guys, but I think others who have been thinking about it or even trying to talk to the young people about how to even transition or if they should or not. Diane, the demo is fantastic and we're going to continue to use that. Thank you for that. And Charles Clark, our social media manager, and just all of you for coming and attending. But again, our youth experts really at the top of all of it. Thank you for doing that. If you have questions, myself and Megan can be reached out to for additional questions. And then, again, we the goal is to not say everybody should be on injectable, but to then just to expand options and to have young people have options for how they get treatment, but also have agency in an autonomy in how they get that treatment is really the goal. And in hearing both Avian and Fashita talk about that is really just underscores to me how important that is. So with that, thank you for attending our JHMI Toolkit. We're there in Japanese as well. Prior episodes are available, so scan that and really get in there, see something